Have you been prescribed those medications?
I've been prescribed about 3 years, but I haven't been taking them for 3 years. I don't remember when I stopped taking them.
Okay, and are you employed right now?
I am not, no.
Do you have any allergies and medications?
I don't have any allergies, no.
Okay. And do you have any other medical problems that you know? I'm looking here that you said you also took a sugar pill. Were you diagnosed with diabetes at one time?
I think someone said something a long time ago that I might need to take something, but I don't believe them.
Well, also in your general survey, we've also gotten your height and weight, and I will tell you, I'm sorry to tell you that unfortunately your BMI shows a level of obesity. Okay?
I disagree with that.
Okay. Well, we'll just continue to go on and we will move forward and we can see what we can do for you here, okay? So also in your general survey today, when you came in, I watched as you walked in, I'm noticing your general appearance. I did notice that when you walked in that you were short of breath.
I am short.
And that you appeared to be slightly
I walked
sweaty.
a long way in here, but I did get sweaty, yes.
Okay. So then we're going to move on to the neurological status. And what I'm going to assess here is I'm looking at specifically brain function. And I'm sorry, I have your chart here. Do you mind that if I chart on our computer system here? Okay. So then I'm looking at your chart here, and I'm just looking at some of the things that you fill out on your questionnaire here. So you've told me your name is Amy. Can you tell me what year it is?
It's 2016.
Okay, and who's the President of the United States?
President Obama.
Okay, and as you're telling me that, I'm looking at you here, and I see that you're following me with your eyes. Have you noticed any weakness on one side of your body or the other?
No.
No slurred speech?
No.
Okay, and can you squeeze both my hands here? Perfect. Can you lift both your arms up? Okay, can you push down with your feet and pull up? Okay, very good. That's very good. No headaches or blurry vision? Okay. And so now we're reaching the cardiac portion, and I know that portion is very important because you have been prescribed blood pressure medications that you haven't been taking, and we discussed prior that that is concerning to me because I'm thinking that you're in one of the stages of heart failure. Okay, so then I'm going to listen to your heart sounds here. Okay, and we'll do your lung sounds later. Okay. And I'm going to count your heart rate now, okay? And I'm actually going to count for 1 full minute. Okay, now I'm going to feel your peripheral pulses, okay? And your heart rate was 125, okay? Have you noticed that it's kind of speeding?
My heart races, yes.
Okay. I'm also going to feel the pulses that are down here in your feet, okay? And it's important because I'm suspecting that you do have heart failure, and a rapid heart rate is definitely one of the indicators, as well as I can feel differences in your pulse. Your pulse doesn't feel as strong down here in your extremities as I would expect it to feel, which would lead me to believe that your left ventricle is not sufficient. Also, I'm noticing some edema down here in your extremities, some pitting edema in your feet and your ankles, which is very indicative of the heart failure that I'm suspecting, okay? Now, respiratory-wise, I'm going to go ahead and listen to your lung sounds. Do you still feel short of breath right now?
Not at the moment, but as soon as I get up, I would probably
start feeling. So I'm going to get you to lean forward, and I am going to listen to you take a nice deep breath in and out. Again, in and out. Okay, and you can rest back there. And as I said, I do hear what we call rails in your lung bases. I did hear a S3 heart sound in your with your chest when I listen to your heart, and that S3 sound with tachycardia is indicative of that heart failure that we discussed. It's an extra heart sound that typically would not happen if you didn't have the heart failure. I am hearing rails in your lung bases, and that just represents congestion that's there, and that would also be due to the congestion of the heart failure that we discussed, okay? And you were short of breath now. Have you noticed, are you more short of breath at night because that nocturnal?
Yeah,
and then when you sit up, do you notice that that gets better? Okay. Okay, and for your GI system, I am going to go ahead and listen to your bowel sounds here. Have you noticed any nausea or vomiting? Are you having any GI pain at all?
Sometimes at night, but no.
Okay, are you eating okay? Okay. So
I
am gonna, you're eating a lot?
Yeah, I eat a lot.
Okay, and with that, with this system, let me just press. Are you having any pain when I touch there? Okay, and I'm gonna listen to your stomach. Okay, I am hearing very good bowel sounds. And so you haven't had any nausea, vomiting, no constipation, no diarrhea.
No.
Do you have regular bowel movements every day?
Pretty much.
No blood in your stools.
No.
Okay, as far as your GI system, we are going to take time to talk about that diabetes. You said you had a sugar pill, but you have not been taking that as
Right.
well.
I don't believe them.
Well, I'm going to have to tell you that according to your lab results today, and we're going to get more into detail with this, your hemoglobin A1C was at 9.1, and that represents diabetes that's out of control. Okay? All right, musculoskeletal. So, are you having any pain in your joints or anything?
No.
No, nothing broken?
No.
No? Okay, here with your legs, no pain in any of your joints or anything like
No.
that? You're moving okay?
Mhm.
No difficulty moving?
No difficulty.
Okay. Okay, so genital urinary. Are any blood in your urine?
No.
Are you urinating well every day?
Yes, I'm fine.
Okay. Do you drink enough fluids?
Yes.
Okay, we did get a urine sample when you came in, so that's great. Okay, for your skin, I am noticing that you look kind of pale and that your skin is very diaphoretic. Do you have the sweatiness
I do
often?
sweat a lot, yeah.
Do you find that that's more at night?
Yes.
Okay. And I'm sorry, I'm putting some things into the computer here, okay? I know we've taken a lot of time to talk about the physical, and before I go on with some of your test results here and what I think is specifically going on, I just want to know, are you having any problems with any mental distress at all? Or you feel like you lost your job? How are you doing with that?
I mean, I'm fine with it. I got plenty of things to do to keep me busy, but I don't need a job.
Okay, so then are you married?
I am married.
Do you have children?
I do.
Okay. So being that you've been out of work, is there any needs that we can help you with here?
Well, I know that the doctor told me I need to take some pills, but I can't afford them. You know, my insurance won't pay for any of my health insurance or my health problems. So, I mean, that's the only thing that I really realized that I might need help with. I don't.
Okay. Well, the things that I feel like that are going on with you, do you feel that you have resources there as far as people at home that can help you go through all the changes that I'm going to recommend to you today?
Yeah, I think so, hopefully.
You do?
Mm-hmm.
Okay. Spiritually, is there anything that we can do for you in that aspect?
No.
Okay. So considering all that's going on with you, how do you feel that you're handling this stress right now in your life?
It's okay.
Okay.
It's okay.
Okay, we do have resources here that I'm going to actually set you up with a caseworker who's going to help you with those things with your job and everything.
Good,
Okay,
that's probably
with
helpful.
not having employment and help
Right.
you with the resources at home. Okay.
Mm-hmm.
So Amy, based upon what I found today, I really believe in that you're in heart failure, and I'm going to tell you why. Okay, so in your general survey when you came in today and I looked at you, I did notice, as I told you, that you were short of breath, and I did notice the sweatiness and the diaphoresis. Okay, that's not enough to make a diagnosis of heart failure based on the physical assessment, but it all works together hand in hand to give us a clue as to what's going on with you today. I know neurologically speaking, you did tell me earlier when you were coming in that you felt like you weren't energetic and that you had some gaps in your memory, and that can also be indicative of heart failure. I know cardiac wise we did do some testing for you prior to today, which gave me a really good clue. We actually did a BNP level, and that level definitely confirms that, I'm looking here at the results here, that it's heart failure in addition to the other tests that I ordered. Actually, your liver function tests were fine. As I said, your hemoglobin A1C was elevated, and that's that diabetes that's been out of control. Your chest x-ray, I'm looking at that now, and that does show the fluid on your lungs, and I told you that when I listened to your lung sounds, I did hear those rails that were happening, okay? We also did an ECG for you today, and on that ECG, I told you that your heart rate was elevated. That also did show some elevation. Okay, and further here, I'm looking at your echocardiogram, and thank you so much for coming in to have that done as well. And that test is very important in diagnosing heart failure because we're looking at a difference between systolic heart failure and diastolic heart failure. And I'm seeing here from this test that you are definitely in systolic heart failure, okay? And we were looked at, while we did the echocardiogram, we also looked at your valves, and your valves actually look pretty good considering where I feel that you are in your level here of your heart failure, okay? We did that stress test, and you didn't pass the stress test. You weren't able to continue on with it and walk on that treadmill because your shortness of breath was too difficult. Sorry, excuse me. So based upon these findings, your assessment and your blood test and your other testing today lines up with the diagnosis of heart failure. And I have to tell you that because you have your diagnosis of obesity and diabetes, and you have your uncontrolled hypertension because your blood pressure today was 184/110. Because of that high blood pressure, that's all put stress on your heart. And so your heart isn't able to compensate for that. And so it's gone into what we call heart failure, which means that your ventricles are not doing its job to get oxygenated blood to the rest of your body. Okay, so that's why we see those, that pitting edema and the lung sounds as you have the rales, and that's why you're short of breath, because basically that's a hallmark sign of the cardiac failure, is that your body isn't able to put that fluid, it's not able to get the fluid pumped out of your body in the correct way. I'm trying to explain that in layman's terms, sorry. So it actually, your body does a lot to try to maintain homeostasis, and when it can't, when the heart can't do its job of pumping, basically it gets tired. And so it gets tired, and your left ventricles get stressed, and it can't do its job. And so it gets kind of lazy, if you want to think about it that way. So instead of it beating fast like it should, it really slows down and it can't do its job anymore. And so that's why you're seeing the symptoms that you're seeing. What I would like to do is get your blood pressure under control, get your diabetes under control, put you on an eating plan, have social work with you so that you can get medications that you need, because we can actually stop it. I don't want you to be put in the hospital, because that's the spiral we don't want to go down. There are things that we can do here to get you in a good place, okay? So actually I have a handout for you here that talks about your diagnosis today, and what we've been discussing this. And you can see that the uncontrolled high blood pressure is what put you at risk for this, okay? You're not pregnant, there's no long-term alcohol abuse. But the uncontrolled hypertension, that's like one of the leading causes of the heart failure, and that's what we're seeing here today. Okay, and so here's what it's saying: the heart fails in its attempt to make up for the lost pumping power. And so that's why we get into heart failure. You see those diagrams there. And so here it talks about some things that you've been having. You've been having the shortness of breath, you've been having the swelling, you've been having the lack of energy, and we talked about the difficulty sleeping. You don't have a swollen or tender abdomen. That's good, because often with heart failure we do see an enlarged liver, and you don't have that at this point. But you have been having that cough. Okay. We talked about you don't have increased urination at night, but that's also one of the common symptoms. But the confusion and impaired memory, we did talk about that you did have that, okay? So just want to let you know some of the symptoms that are there, and that this is all lines up with your testing. And so then on this next page here, it talks about the symptoms of what class that you're in. And there's actually 4 different classifications of heart failure. And I'm going to say that you are probably in, if I'm looking at this, that you're in class 3, which you do have some limitations, but you are able to participate in some activities, and you're comfortable only at rest. The good news about all this is we have an exciting new program that's going to be starting here at DRHA that's going to address this issue and where you are, and help you to not be hospitalized, and help you maintain at home. And it's going to involve us working together. And I believe that we can work together if you're motivated, so that this doesn't progress. I will tell you that a lot of people that are diagnosed with heart failure, within 5 years, they're gone. But that doesn't have to be you. Okay? So, based on our findings today, we can move forward with this if you want to. How do you feel about that?
I'm very excited to do that, yes.
Okay. All right. Thank you very much for letting me assess you today. And we will be following up with you. I'm going to make an appointment. I'm going to have my nurse practitioner to come in and make an appointment with you to follow up for next week. Is that okay?
That'd be great.
Okay.